This is the month of March, and we're doing everything hormones. And every day, put a little snippet about hormones, their benefits, and attempt to demystify the mystery of hormones. I think so many times we are confused by them because there's so much emotion, and with lack of scientific data to kind of connect the thought to practice, it promotes a lot of fear. So we're just going to try to go through all that we know, find articles related to it, and make it much less fearful and much more scientific, because that's logical and logic makes sense. When we are looking at progesterone, that's what we're going to talk about today ever so briefly. And specifically, I had a patient that went to see a physician who helps people with sleep, and that physician told that patient that he had never heard that progesterone assists people with sleep. And I thought, oh my gosh, well, let me Google progesterone with sleep. Okay, because so much we go to our internet and we think the internet is the wizard, so let's do it. So I have trouble with my iPad popping out. So does progesterone help people sleep? First thing I get, progesterone increases production of GABA. GABA is an anti-excitatory neurotransmitter that does help us sleep. Low progesterone can bring about anxiety and restlessness with associated trouble sleeping, including a tendency to wake frequently during the night. And that is from the sleep doctor, but also if we're going to Google down to find other studies that may be suggestive, would include the effects of progesterone on sleep, a possible pharmacological treatment for sleep breathing disorders. And that was from the NCBI and the National Institutes of Health from the government. Also other articles, including from the Oxford University Press, about how progesterone prevents sleep disturbances and modulates growth hormone, thyroid hormone, and melatonin secretion in postmenopausal women. And that was published in the Journal of Clinical Endocrinology and Metabolism. So yes, there is data to support the fact that progesterone does help some individuals sleep, and that is by common belief systems, as well as I believe some scientific journals are supportive of that philosophy. Day in and day out, I see a lot of patients that actually get benefit from progesterone helping them sleep. And as we get into our over the age of 35 and certainly into our 40s, we don't ovulate as regularly. Hence, without the progesterone, we don't sleep as effectively. So I do believe that progesterone helps many women sleep through the mechanism of breaking down to GABA, and those articles are a couple of reference points if you would like to look that up yourself. And stay tuned for each day, a little tidbit trying to coordinate science with hormones.